and had to live with breast cancer, and certainly many who are surviving and many who are still learning. Of course, one of the things that's important to women is that the recommendation of us getting our mammograms on an annual basis, and especially starting at certain ages. And we're finding that even now, more and more younger people, young women, are being diagnosed with breast cancer. Even when we look at the statistics, also the numbers are showing that there are men who've been diagnosed with breast cancer as well. And so, because of this, On Point with Juandolyn Stokes is always about and promoting living well and winning well. And because that's what we promote, certainly that's what we want to talk with you about, being in that special place of wealth and, of course, health. And because we're concerned about you and concerned about your bodies, we certainly want to make sure that we talk to you about things that are very important. And breast cancer awareness is something that's very dear to the hearts of so many. So even when we think about it and when we look at some of these numbers when it comes to breast cancer, every year breast cancer accounts for about 30% of all new cancer cases in US women. And that is a fact when you look at these numbers and when you see what's really happening. Approximately 1 in 8 women, 13% in the United States will develop invasive breast cancer at some point in their life. And this is why there's encouragement for women always to make sure you go and get that mammogram. And even when we look at the medical field, that there have been a lot of advances in screening and treatments, they have reduced the overall risk of death from the disease, while the number of people diagnosed with breast cancer continues to rise. And one report has found that breast cancer incidence increased by 1%. That's right, 1% per year between 2012 and 2021. Now, when you look at how common is breast cancer? I mean, it's the most common cancer diagnosed among women in the United States. And each year, about 30% of all newly diagnosed cancers in women are breast cancer. And even this year in 2024, approximately 311,000 women will be diagnosed with invasive breast cancer, and 16% of which will be in women younger than 50 years of age. And then also, nearly about 57,000 women will be diagnosed with ductal carcinoma, of course, cancers. And of course, you've got about 66% of breast cancer cases are diagnosed at localized stage. That's before the cancer has spread outside of the breast, when treatments tend to really work better. And there are currently more than 4 million women with a history of breast cancer in the United States. And this includes women currently being treated and women who have finished their treatment. And less than 1% of all breast cancer occur in men. But we're going to talk about it coming up next. I've got a very special guest. Dr. Ryland Gore will be sharing with us, who is a breast surgeon, and of course, she's the founder of the Dream Care Breast Center. So we'll be back. WAOK Goes Pink, On Point with Juandolyn Stokes, celebrating and really honoring Breast Cancer Awareness Month. We'll be back. We are online. We are live here on Facebook, as well as we're broadcasting on the air. So on the air right now, we are doing our commercials, and then we're going to come back shortly. My guest is standing by. So those of you who are here with us on Facebook Live, just hold tight a second. We'll be back. And I certainly, want to hear you in the comments and just talk about and post how you are excited about this conversation about breast cancer. And of course, it's all about educating, informing, because we need to be in the know. We want to all live well and win well. And so that's so very key to what we're doing here. And that's why this is important to us. We didn't just want to be live on the air, but we want to touch you right where you are. So maybe you're at home, maybe you're in your office, maybe you're trying to ride. I won't say drive. live. Or maybe you're riding with somebody and you say, you know what, I want the visual. I want to see Dr. Gore. I want to go face to face with Juandolyn Stokes as we engage in this conversation. So that's why we are here today. And for those of you who are watching on Facebook, share it, like it, and share it with others in your community because we've got to get the word out. We can talk all we want to and have this discussion, and that's so very important that we share and talk with one another. But we've got to hear from the experts. And Dr. Gore is one of those wonderful and amazing experts that's going to be talking to us shortly. So I want you to stand by and not go anywhere because we are engaged in this conversation about breast cancer. And as I was just talking, sometimes we think it's just all for women, but also, for men as well. And we'll talk about that too. I'll never forget just a few years ago, one of my dear friends was diagnosed with breast cancer. Maybe you have loved ones. I've had breast cancer survivors on before, some who have transitioned. And so I think about them, I think about family members, I think about listeners, I think about all of you. And sometimes, I remember those times when I was really kind of afraid of going to get a mammogram. I don't know what for. There was this myth in the back of my mind that if you go get this mammogram, it's going to squeeze everything. It's going to squeeze some girls and make you feel some kind of way. You're going to be in a whole lot of pain. Juandolyn Stokes, I don't like no pain. So, but that was how I felt, at that time, early on in my adult life. But of course, once I turned, 50, I said, I've got to go do this, because that's what the doctors are recommending, get your annual mammogram. And so I finally got over that fear because sometimes there's little things like that that will keep you from going to get your mammogram or going to the doctor. But this is very critical. It's best to do it now than to wait to prolong and put it off. So I'm encouraging you. You got to follow up. You got to take care of yourself, and don't be afraid to go to the doctor. And if you still kind of working through it, take a friend, take a family member with you as well. I think that's so very, very important. So we're going to go back and give us just a second, and we're going to go back live on the air. I'm waiting on my producer right now to let me know when we're going to go back live on the air. I'm seeing now we're coming in. Let's see. I think we're counting down. Let's go. Let's go. Let's see. Give me just a second.
Okay.
All right. Just got 1 minute. All right. And we'll be on. Listen, we're doing it. We're doing multiple things at the same time. Ooh, got the Gore, got the Gore,
You're
honey.
doing it. You're doing it. You're doing
We
it.
are live on the air and we're trying to do this, but this is all good. This is what it's all about.
Absolutely.
Yeah, let's see. Testing, Dr. Gore. Let me see if I can hear you.
Can you hear me?
Okay, I can hear you.
Okay.
Let's see. Let's do a test here. We are live back here on 1380 WAOK. We are also live on Facebook, on WAOK's Facebook page. And I've got Dr. Gore here with me, and callers. Certainly, we've got you coming up as well. But let's go. Let's see. Dr. Gore, can you hear me now?
Yeah, absolutely. Can you hear me?
I'm still trying to hear you, love.
Oh
Let's see.
man. Um,
Let's see. We're trying to work it out. We're going to work it out in just a moment. Stand by, everybody. Let's see. Let's see. And it might be something
I don't know what to
on
do.
my end. Tell you what we're going to do. Make sure. So, Dr. Gore, you can hear me.
Mhm.
I can't hear you. Let's see. We'll go to break and let's come right back and let's work out making sure we can hear one another. We'll go to break and we'll be right back.
No, I just know how to read lips. Can you hear me? No, I can't hear you. But you can hear me?
Dr. Gore, can you hear me now?
Yes.
Okay, she can hear me now. Yes, I can hear her now.
You can hear me?
How did you want me to do so the calls will come through on the audio? Perfect. All right, thanks. Hello, hello, hello. Don't you just love it?
I love it. I love it.
Oh Lord, now I can't hear you again. Let's
Oh
see.
no.
Let's see here.
I can hear you perfectly now.
Hmm. I wonder why. We are trying our best. Thank you for letting us know. We're trying to work through you not hearing me.
I
Okay.
can I can hear you. I don't think.
Okay. Now I can hear you.
Okay, perfect.
Perfect. All right. I think we're good. Thank you so much, those of you who are commenting in the chat. And I think we can both hear each other. Dr. Gore,
Mhm.
welcome to On Point
Thank you.
again.
Thank you. So good to be
How
back.
are you?
I'm good. As you know, it's been kind of crazy around here. Um,
Yeah, yeah, yeah.
Everything has been fantastic. I just opened
Wow.
the office, my new
Awesome.
private practice. Yeah.
So your new private practice, right? Tell us all about it.
So the name is Dream Breast Care Center. As some of you may know, a lot of you may not know, I'm a breast surgical oncologist. So I take care of breast cancer patients and patients who have breast issues. Not all of my patients are suffering with breast cancer, but for a long time, I worked for one of the major hospitals here, but now I have my own office where I'll be seeing patients. So it's been amazing. It's been a blessing. It's a journey. Like, let's be very clear about that. But
Yeah.
I'm so happy to have this space. So I'm serving the metropolitan Atlanta area. We're right in Buckhead off of East Paces. So, like I always tell people, I hope you don't need me, but if you do, I'm here. And Juandolyn, you've known me for a long time, so
Yes.
you've seen the entire journey. So
Hmm.
it's amazing to be able to share this with you.
Yeah, it's great to have you here sharing with us because you have so much passion. What is your approach in terms of maybe your core values around how you deal with your patients overall?
At the core, there's got to be excellence. There has to be a knowledge base, right? I think it's fair to say for many minority physicians. If you make it this far, like, you know something. It's a tough process, period. But compassion and being able to really sit down with the patient, see them for who they are, and really take the time, because I find that so many patients are scared. They don't know what's going on. Sometimes it's not even cancer, but they are so afraid. And it's time out for physicians who don't care. It's time out for those who can't give culturally competent care. It's time out for not listening. We really got to meet people where they are so that we can really see them and feel them and truly take care of their needs. And that's
That's great.
everybody.
Yeah, yeah, that is for everybody. When you think about that diagnosis, prior to that, what is it now? What are you all saying now in the field when people should go and get tested or get mammograms, or and what are some of the symptoms and things that they should look for?
It's an interesting conversation because there's always back and forth on when people should start their mammograms. And it, at least from one standpoint, the United States Preventive Services Task Force, which most of our primary care docs look to for guidance on when patients should have screenings. For a long time, they said patients should start at 50 and then get it done every other year. That's shenanigans. I call shenanigans. They finally moved that down to 40 this year and made a statement on that, still saying every other year. At the end of the day, most oncologists will recommend that patients get their mammograms done every single year, starting at 40, and that's for average risk. But when we talk about breast cancer in Black women and other minorities, we are more likely to be diagnosed with cancer before the age of 40. And so there have been calls by organizations such as the American College of Radiology that Black women and other minority women should probably start their mammograms at 35, due to the fact that we're more likely to be diagnosed with breast cancer before the age of 40. And this is something that I have incorporated into my practice, and I think it's very important. I think I've shared with you before, over the years, my youngest patient I diagnosed, who was a Black woman, was 19 with breast cancer. And so you see this, I'm seeing more patients getting diagnosed in their 20s and 30s, and you see this and you can't help but wonder, like, are the recommendations getting it wrong? And so textbook is textbook, but every single patient is different. And so you have to take that into consideration with your approach.
Why is it? Why is it that so many Black American, women and men being diagnosed with breast cancer? What are some of those causes or factors contributing to that?
So the two top reasons for getting breast cancer, the two biggest risk factors, being a woman and getting older. I think what is accounting for the younger and younger ages, honestly, you can't help but wonder, environment. Is it our environment? The foods we eat? Um, Everything is pumped with antibiotics. Everything is super processed. Everything has a million preservatives. Is it where do we live? Are we close to, um, we just had a huge fire out in Conyers, right? A huge
Yeah.
chemical fire. What's being dumped into our land? What's being dumped into our waters? Are there any plants, nuclear plants? These are things that we really have to consider. And so I think that social determinants of health and environmental justice play a huge role in cancer risk.
Wow, that's amazing. You just never really thought that, but certainly that is important. I think a lot of those environmental factors you said are important, and also when you were talking about food, like younger age groups, so you think sometimes eating a lot of processed foods, fried food.
Everything comes from the freezer or a bag with these kids, and it's quick, it's easy, but I think it's also killing us. A big thing that has become very important for Black women and other women, our hair care, right? Our beauty, our makeup. Is it tainted? Are there things that we need to be looking at in there? As you know, the natural hair care movement is a huge thing, and studies are showing, and lawsuits are popping out on, perms and dyes and all these other things, increasing the risk of not just breast cancer, but other female cancers such as uterine cancer, ovarian cancer, because of the fact that a lot of these chemicals that they use in it mimic estrogen. If you increase your estrogen levels, you're going to increase your breast cancer risk and risk of other female related cancers. And so I think all of these things tie together, and all of these things should be taken into consideration.
Awesome, awesome. Let's go to break and we'll be back with more. We're live right here on 1380 WAOK. We were also live on Facebook on WAOK. So we'll go to break and we'll be right back. Dr. Gore, we're on break on the radio, but we're still live video wise.
Mhm.
I want to ask you about you know, tips you have for women starting a business, like with your own center now, and the hard work you had mentioned earlier. You know, what are some of the things that you recommend to people to be aware of, conscious of, and starting their own business, like you started your own practice?
One thing that I never thought about, the financing involved and making sure you have good mentors to help with financing, getting, I know several doctors that have their own practices. And so I would call them and say, hey, when you started out, how did you do this? And what did you take into consideration? Even before I went the banking route and started that process of getting a business loan, you got to have a business plan. But you have to. There's no way around it. And so I think really honing in on what that business looks like and what you're offering and what the 1 year goal, 3 year goal, 5 year goal was wild. I had never written a business plan in my life. Y'all should have seen me on Google. It was me and Google. And I'm like, all right, how do I write? I want to start a practice. How do I do this? Like, nobody teaches you this. And so I started there and went to several banks. One thing I will say, get used to hearing no. And it is hard getting a business loan. I was like, if I'm a surgeon and I'm having a tough time getting a business loan, I don't know what regular people are doing. Like, I don't know
Mhm.
what the everyday person is doing because this is hard. Um, you know, I had a few no's before I got that yes, and that yes was the best yes. I was happy for those no's when I got that yes. And then going through the process, architects, contractor, it's been a huge learning curve. It's been
Wow.
a huge learning curve, but have mentors and people that you can call. Get ready for the highs and the lows of it all. I
Mhm.
think every entrepreneur, I don't know, I don't care what, business you're in, they experience that. And so it's been interesting. And this is coming
Yeah.
from somebody, y'all, I am not a business person at all. I feel like I'm learning on the job right now.
You're a surgeon. You just want to help people.
What?
Wow. What would you say you did that helped keeping you going when you kept hearing
Faith.
no?
Faith.
Mm.
Faith. When I tell you I will never, I don't know what everybody else believes, but I know what I believe. I will never question God again. I will never question, his call on my life or what I'm supposed to do. And keeping my faith during some of the, like, when I tell you, very dark moments. And to be on the other side of that and see everything that's happened, uh, that faith, my faith.
Mm. Wow, wow. And it's certainly, what about those self-talks, those talks to yourself?
You just gotta hype yourself up. I don't even know what else to say. I would literally have post-it notes all over the house, like, you can do it. I would have scriptures to myself, and today is gonna be an amazing day, and scriptures, and do not worry about anything, but through prayer and supplication. Listen, anything I could do to hype myself up, telling myself that you can do this, you got this. I know the plans I have for you, plans to prosper you. Like when I tell you, it was like all day self-talk.
Wow. Wow.
Seriously.
Yeah, and that's important. That's important that you have to certainly, talk to yourself, encourage yourself, and just to, just to build your faith, and certainly it keeps you going because oftentimes you can easily get discouraged. You can
Absolutely.
easily, feel defeated, but persevering, and so I'm certainly glad that you kept the faith and kept building your faith in God. We're talking with the founder of the Dream Breast Care Center Center in the Buckhead area of Atlanta, Georgia. It's a place, a safe place for people to go. I've personally been knowing Dr. Gore for years, and just knowing her as an awesome breast surgeon, a passionate woman, and who cares about individuals and want to help you through it. And we are welcoming all of you back to On Point with Juandolyn Stokes right here on 1380 WAOK. We are live on Facebook and we are live on our radio station. Dr. Gore, welcome back. I want to ask you, you mentioned estrogen. And I want you to elaborate on that a little bit more as that relates to cancer, breast cancer.
Estrogen, as you know, one of the female hormones along with progesterone, and your body, first of all, your body needs it. That's what's responsible for us being women, right? And some of the characteristics we have as women. But most cancers are also hormone positive, estrogen and progesterone positive. And that's just because breast cancer is typically a female cancer, but we see it overexpressed in most cancers also. And so decreasing your lifetime exposure to estrogen is important. And so there are some things that patients don't think about. Some people worry about their birth control pills. If you are on birth control and you do get a breast cancer diagnosis, we are going to tell you to stop that. But for example, postmenopausal women, they are miserable when they go through menopause. And so some women will get on hormone replacement therapy. This is meant to be brief. This is not meant to be for years and years and years. I've seen women, on hormone replacement therapy for 30 years straight with no breaks. And then, of course, they pop up with the small breast cancer because the estrogen is driving it. It's stimulating the breast tissue. It's driving it. And so I think that's important. Some people say, okay, how do I have breast cancer? I don't have any estrogen anymore because I went through menopause. After menopause, your ovaries are no longer responsible for estrogen production, but our fat cells, our bodies are very crafty. Our fat cells know how to turn fat into estrogen. And so for women who are postmenopausal, when we are treating their breast cancer, we have pills that block that activity, block the body from using the fat cells and turning it into estrogen. So it goes without saying, the higher your body fat composition, the higher your risk of developing cancer, unfortunately. And so when we say clean eating, exercising, staying active is not just to irritate you. It'll help decrease your risk of breast cancer and some other cancers as well. Smoking, some of our other lifestyle things that we do, smoking, it increases your risk of developing quite a few cancers. What else? Alcohol, there's been shown to be a relationship between alcohol use and developing not just breast cancer, but other cancers. And so all of these things to keep in mind, how our lifestyle sometimes impacts our cancer risk.
That's important to know. What about vitamins? Some people taking certain vitamins and supplements every day. Are there some that individuals should stay away from as it relates to breast cancer?
No, not necessarily. No.
Okay. All right. Good.
I tell patients, I just need to know what all your vitamins, supplements, especially my Asian patients, they have so many different supplements that they use from their culture that clearly work. They live right but the issue is not cancer risk. It's when it's time to go to surgery. And sometimes some of these supplements can increase your bleeding risk. And so sometimes patients say, well, I don't take any medication. Yeah, you may not take traditional medications that you picked up from a pharmacy, but there are other medications that still impact how we do things. So just something to be mindful of.
Mm-hmm. Let's get our phone lines. I've got Jihad holding. Jihad, welcome to On Point with Juandolyn Stokes. How are you? Jihad, are you here? Let me come back to Jihad. Are there different types of like mammograms or different approaches to mammograms now?
So the standard used to be the 2D, where you just get two pictures. Boom, you're done with your screening mammogram. What we prefer now and what is very useful is the 3D mammograms. That's when the mammogram machine takes a few more pictures. You get extra cuts and it makes a CT composite for us so that it's much easier to pick up on small masses, differentiate between a cyst versus a mass that's worrisome. And so it's extremely helpful, especially for patients that have denser breast tissue, because it decreases the risk of callbacks and decreases the need for biopsies because you can see everything clearer. There are some mammograms. Insurance doesn't really pay for them a lot, so it's really tough to get, but contrast enhanced mammograms where you'll get contrast through the IV while you're getting your mammogram to help also see what lights up and pick up on masses and other concerning findings a little bit easier. But I think what most patients need to know, if you get offered a 3D mammogram, take it. Take it.
Mm.
And that's the standard of care now.
Okay, okay, good. Because I was going to ask you about insurance and which ones they do not readily uh,
Screening
cover.
screening mammograms should be paid for. This isn't something now, if it's diagnostic, meaning say you walked in with a complaint, I have this mass that's bothering me, or I've noticed a nipple discharge. All of these are potential signs of cancer. If you have a complaint, it's not just the screening anymore. You may need additional pictures on the spot. You may need an ultrasound on the spot, but more importantly, the radiologist looks at those pictures and reads it the same day at that same moment while you're getting the pictures done. And so, diagnostic, you will most likely have a charge, and so a lot of patients get confused about that. Screening
Mm.
is when, hey, I'm feeling fine, nothing's going on. I walked into the center, got my mammogram done. Boom, that's it.
Yeah,
So
yeah.
that's the difference.
I see, I see. Let's go to Jihad. I think he's connected now. Jihad, are you on? Let's see if I can get Jihad, one of our callers.
Okay.
Jihad, are you here? Okay. All right, we'll come back. What are some of the things that women should look out for when they're at home and they're, trying to check? What is the recommendations nowadays?
So I tell patients, check it. You should know what normal is for you so that when something abnormal happens, whether it's a new lump or whatever, you can easily spot that and immediately seek help. Do your do your self check at least once a month. I tell patients to do it after their menstrual cycle just because the breast tissue feels different before and after your period. If you're no longer getting menstrual cycles, then that's not a thing for you. But whether it's in the shower, in the mirror, it's easier sometimes for patients to look in the mirror because they can see everything versus in the shower where you're looking down and depending on your breast size. But take a look at your breast with your hands and your arms to your side and with your hands up, because sometimes when you lift your hands, it moves the muscles, and sometimes things that you didn't see before might pop out. Obviously, if you feel a new lump, but any nipple changes, nipple inversion, nipple discharge, new rashes that you don't have a reason for. You can't say it's a bug bite. You can't say it was a change in your laundry or perfume or something like that. Any swelling of the breast or new redness of the breast. And certainly if one breast becomes much larger or much smaller than the other, those are very concerning. And please be mindful of the fact that breast tissue goes all the way up into the armpit. So when you're feeling around and feeling for masses, feel up into underneath the arm also.
Wow. Okay. Okay. That's very important to know. When it comes to that diagnosis, what happens in that moment medically, after that?
So patients, they usually either go to their primary care first because that's typically the person that ordered the imaging or found it, or they find their way to me. From me, depending on the size and the stage, based on your imaging, you may or may not need chemotherapy first. Be mindful though that surgery, unless you're stage 4 and during your workup, we see that cancer is not just in the breast or the lymph nodes, but all over the body and other parts of the body. If you're not stage 4, you're somewhere between stage 1 and 3, you are going to get surgery at some point. The larger the tumor, and certainly if we see that there are lymph nodes involved, you will you may need chemotherapy first. There are some patients who need radiation. Depending on the type of surgery you get, you may need radiation, and so just be mindful of that as well.
What about the psychological part after the diagnosis and you dealing with your patients?
It's tough. I find that patients who have a strong support system, even for those whose system may be a little rocky, but they may not necessarily be religious, but they have some sort of spirituality, some kind of guiding force or principle. Those patients always do much better than the ones that don't have support and don't have some kind of ethos that they lean into. You know what I'm saying?
Yeah, yeah, yeah.
Um, those patients always do better. There's even studies that show it. It's very interesting. And
Mhm.
I will say, I tell all of my patients, whether it's anger, sad, whatever it is, some patients come in and they are crumbling. Some patients come in and they are so strong. They're like, oh, I already thought about this. Let's do this. I'm ready to tackle it. Everybody is different, and all of those feelings are valid. Okay. So I
Right.
tell patients, don't your feelings are your feelings. I think if I were to I would be PO'd, if this happened to me. I feel like I would go through every single range of emotions probably within 5 minutes. And so your feelings are valid. But if you can just get together a strong support system and realize sometimes that's not your family. Sometimes that's not your blood family. Sometimes it's a church member or a coworker. You would be surprised who shows up for you if they know what's going on. So never underestimate your circle also.
That's good. That's good. When it comes to radiation, do all patients tend to lose their hair? You
No,
know,
you will not lose your hair with radiation. That's like an outward treatment.
okay.
So it's kind of like getting an X-ray every day. So patients will notice skin changes. Sometimes patients, depending on where they go and how well they do it, sometimes there are burns, but typically it looks like a sunburn and it's reversible over time. With chemotherapy, those are the IV drugs that we have to give patients to shrink the tumor, reduce the risk of recurrence throughout the body. Those are the ones, depending on which one you get, that may cause hair loss,
Mhm, mhm.
but not
But
radiation.
so for those who do, are you oftentimes is it at a much severe level with those patients who do lose hair?
Um,
It's just
the
different.
the
Right?
chemotherapy is just strong, and so, like, if whether you're stage 2 or stage 4, like, there are certain chemo drugs where you know that this is what's gonna happen, you know?
Mhm. Yeah. What are the differences between the stages of breast cancer?
When you so number 1, let's go ahead and knock stage 4 out. Stage
Okay.
4 means that the cancer is not in the place where it started. It is somewhere much further away. And so for breast, local disease is when it's confined to the breast or to the lymph nodes underneath the arm. If cancer goes beyond that, whether it's lungs, brain, liver, pelvis, wherever it goes. If it's outside of the breast and the lymph nodes and it has traveled somewhere else, you are stage 4 by definition. And this is not just breast, this is for any cancer. If it travels beyond where it started, you're inching your way to stage 4. Stage 1 through 3, all of that has to do with the size of the tumor and whether lymph nodes are involved. The bigger the tumor, the more lymph nodes involved, the higher the stage.
Mhm. And when you talk about lymph nodes, I want you to elaborate on that a little bit because sometimes you don't hear that until after the surgery in some cases. Can you explain that?
I always comment on lymph nodes before surgery because usually in your mammogram and ultrasound report, they will make mention of the fact of whether the lymph nodes looked normal or not. If they don't look normal, they'll want to biopsy that along with whatever tumor they found in the breast. I call the lymph nodes the trash men of the body. It's their job to clear whether it's an infection, you got a cold, whether it's, a cut and they're trying to clean the scene. They clean the blood. They use the lymph fluid. They clear everything. And all the blood kind of passes through a lymph node at some point. So if you notice when you have a cold and you're like, our grandma, my glands are swollen. Those are they're trying to figure out what's going on and trying to clear the infection. But with cancers, that's the first place cancers like to travel to
Mm,
the lymph
okay.
nodes. And so to stage a patient appropriately, we always need to look at not just the tumor itself, but the lymph nodes in the region. And for the
Mhm.
breast, those lymph nodes, those regional lymph nodes are usually in the armpit. That's the first place breast cancer likes to travel if it's going to travel outside the breast. For patients who are a little bit more advanced, you have lymph nodes everywhere, underneath the muscle, the base of the neck, around the clavicles. And so it's very important to talk about when we're talking about cancer staging, because it plays a role in how well a patient does and if this cancer is likely to recur.
I see. I see. What are some of the treatments that are out there? And have you seen any advances in treatments as it relates to technology over the
So
past
there's
few years?
surgery, chemo, and radiation are always going to be the mainstays, not just in breast, but any cancer. What I think is so encouraging, I don't want to say beautiful,
Okay.
encouraging for breast cancer is that number one is one of the most researched cancers out there, period. And so I feel like every other day new drugs are coming out, especially the immunotherapy drugs we have now, and some of the drugs where they are attaching antibodies to traditional chemo to just find other ways to attack cancer. And so we're seeing patients, even with stage 4, who are able to live for a long time. And so I want to encourage patients that even with a cancer diagnosis, and even if you get a stage 4 diagnosis with breast, it's not a death sentence. We have so many good drugs out there. And I think that those who do bench research, they've done a beautiful job with pushing the mission forward and hopefully one day coming to a cure.
Yeah, yeah, that's the hope to come to a cure because so many women, are
So
impacted by
many
it.
are affected.
Yeah.
Yes.
What about men? What are your thoughts about that?
Oh yeah, I always every time I have to give a talk or something like that, I address the fellas too. It
Okay.
happens at a much lower level, right? They're only about 1% of cases, but that still means 3,000 men this year in the United States are going to get a breast cancer diagnosis. And several prominent Black men have had it. I think we've talked about this before, but Matthew Knowles, Beyonce's dad, is a breast cancer survivor. Um, the late Richard Roundtree, he was a breast cancer survivor. And so this is something that absolutely impacts our men. And the data that's in Black women, Black men mirror that. So Black men are also more likely to have more advanced disease, more aggressive disease. And so these are things to be mindful of. And so I tell everybody, if you feel something, say something, and don't let the fact that you're a man, stop you from seeking evaluation, especially if you feel something.
Yeah, that's good. Let's see if I can get Jihad on now. Jihad, can you hear
How
me?
are you?
Where are you, Jihad?
How y'all doing?
Good
We good.
morning.
Good, good. Thank you for keep trying. I had this question I wanted to ask for a long time, and
Absolutely.
I'll ask the doctor. And we appreciate everything and support everything that you said and doing. But here's my question: when they talk about a cure for cancer, right?
Mhm.
And they're looking for a cure. During the conversation that you had this morning, you mentioned numerous causes. And most of the causes center around chemicals,
Mm.
right?
I
Whether
think
it's
that's
drinking,
definitely a component. It's definitely a component. Yeah.
right, right. So when this is what kind of like contradictory to me because they say they're looking for a cure, but in reality, the information is that a good percentage of these cancers are caused by the chemicals that are in our food, in our atmosphere, and et cetera. And I would say that and if I was a scientist, which I'm not, I would go to one of these countries where people don't have the chemicals that we have and the industries that we have, and they basically live off the earth and et cetera, and see whether or not they develop these same breast cancers and uterine cancers and all these prostate cancer and the things that we develop.
Mhm.
Because clearly, I believe that it's in the chemicals. They know it's in the chemicals. In my opinion, they're looking for a cure to cure the chemical. You know what I mean? Because the chemicals have negative or side effects, but they also provide a benefit. And because we're in an economy capitalistic society, they weigh the two and they really, to be honest with you, they kind of like experiment with us to a degree that they know that our culture and the lifestyle that we live, some of us are going to smoke, some of us are going to drink. We're not going to pay attention to the proper diet, the proper way to eat, and et cetera, and that those numbers are going to be there. And so they develop a whole industry behind this cancer industry, when clearly, in my opinion, they know that the majority of it comes from chemicals, and that it's not something that women are naturally born with. Or is it? Maybe you could tell me. Is
Not
it
naturally, but I think at the end of the day, estrogen, and we all have estrogen, and so I think that outside factors interplay with risk factors we may already have, whether it's your family history, whether it's, you know what, I'm miserable, let me take my hormone replacement therapy. I think I think nature and nurture meet, and sometimes that relationship can be synergistic. I do agree with you that I think that there's a whole lot, especially having traveled abroad and seeing how other countries are, even with their food. I think that there's a lot more that this country could do to protect its people. And, for some of it, and I won't speak too much on it, but sometimes if you follow the money, you can kind of see, where
I didn't want to put you in that position.
I feel like you tried to.
I didn't want seriously. I was trying to wiggle a way around it so I could say it and it just be dropped on me. But I didn't.
I do believe that we are at increased risk for so many things, not just breast, just because of socioeconomic status and where we end up, what's available. Like, do you have fresh food? Probably not. Do you even have a store in your neighborhood? I don't know. But the fact that you have to ask these questions. So I think that there's this. This is something I could talk about all day. I'm very much into health disparities and certain disparities, but I do think that they're linked for sure.
Yeah, because I mean, in all of the industries, to be honest with you, I think that like you really, when you just listen to the commercials on TV on the medicines, like every other commercial on the TV, what you want, basketball, football, or whatever, it's a pill. Every other commercial is a pill, and then they will say to us that after they tell us how great the pill gonna make us feel, make us laugh, bounce up and down, then they'll tell you about 20 things the pill will do to kill you or harm you. So clearly, they understand in the industry that these things that we're giving you, they're not perfect or nothing. They help, but there are also some consequences too. Yeah. And they know that we're not going to, because of the culture that we live in, we're not going to basically have the discipline enough, all of us, including myself, to eat properly and do the proper things. They got us in a
I hear you, Jihad.
Thanks a lot. I appreciate you bringing me back. Thank you.
Yeah, sure.
Absolutely.
Yeah, thanks a lot, Jihad. Let's go to Denise. Denise, welcome to On Point. Dr. Gore is on the line. Go right ahead.
Okay. Yes. Hi. Good morning.
Good morning.
Good morning.
I have a question for the doctor. What if someone may be experiencing some cancer symptoms, just according to what's online, and they don't have medical insurance?
So there are so many resources. The Department of Public Health, the Georgia Department of Public Health, they have a breast and cervical cancer program. You are able to get screenings through that. I know for a fact that Northside and some of the other hospital systems do have free mammograms. They have a van that actually goes around and they go out into the community. And I'm pretty sure, I need to look up, but if you look up Black Health Matters, they are having a health fair this weekend. And so Black Health Matters, the Northside, I know for a fact the Northside mammogram van should be there. There's also sister.
It would be like cervical, or it's not breast, but something like cervical, or.
Well, I would check with the Georgia Department for that. I would check with the Georgia Department of Public Health, and because they do have a breast and cervical cancer program, and they should be able to point you in the direction of where you can get Pap smears and cervical. Yeah.
I'm sorry, let me cut you off. What about ovarian?
That I'm not sure, but they should be able to point you in the when they're doing the cervical, they should be able to help you with the ovarian. All of that is right there, so they should be able to help with that as well. And if you need an ultrasound, be able to help with that.
Okay, thank you so much. That's what I needed to know. Thank you.
All right, you're more than welcome. Thanks for calling. Let's go to Kelly. Kelly, welcome. Dr. Gore's on the line.
Good morning.
Good morning.
I wanted to ask the doctor what vitamins or supplements that we can take that will be good for breast health, for preventive measures that will help keep any cysts from occurring.
I wish I would be rich. Listen, I don't know. Like, we don't have any special vitamins that we tell patients to take for prevention. And so whatever vitamins you already take, those should be okay. What I will say is that when patients have issues with breast pain and things like that, vitamin E can help. And that's one of the fat soluble vitamins. A, D, E, and K are the fat soluble. And so we will tell patients to take vitamin E, but there are no studies to support regularly taking a vitamin for breast cancer prevention. And so I tell patients, I'm okay with you taking your vitamins and supplements because I want you to be healthy. I don't want you to have any deficiencies. That's a good question. Thank you for that. But there are no studies to truly support it.
Yeah.
But you're saying vitamin E would be like the closest thing
that would be like the closest thing. And we do, for patients that have breast pain and fibrocystic disease, to help with symptom control, we do tell them vitamin E as a part of their regimen. Yes.
Okay. Thank you so much.
Thank you, love. Stay healthy, stay connected, stay on point. Before you leave, Gideon. Hi, Gideon. Thanks for holding. Go right ahead. The doctor's on the line.
Hi, Gideon.
Yeah, I know I don't get the jihad treatment where you can hold on and talk. But yeah,
don't do it like that, Gideon, please.
Yeah, we're working through technical difficulties, Gideon. That's what we're working through.
It's all good.
We love you too.
I'm mad. But anyway, the doctor, I really appreciate her being very upfront. And unfortunately, in our community, many of us are not upfront with the diagnoses and the things that we are dealing with. My mother transitioned from breast cancer. And one of the things that really affected me is seeing this huge edifice to ecclesiastical corporation downtown, the Emory Center. These centers are so huge and so such monstrosities of economic power in our communities that we've been thrust into. My question one, why is it that we have to compare ourselves with white women? Why do Black women have to compare themselves to white women? And secondly, the commercial just came on before you guys were on. Black women rate of cancer, white women. They have not had to go through the things that we have to go through in racial discrimination, in medical situations, in economic and education that we have had to go through. And lastly, your thoughts, and you mentioned, which is very powerful, about the chemicals and the hair products that have been used that create cancers. And Jihad touched on the food items. We know that it's ubiquitous, and doctors don't seem to have any power to restrict products from coming into this country, which is what Jihad talked about. But Japan has the least amount of cancer. They already know the statistics and what they're doing. They do it intentionally with GMOs and all those other things. Those are my two questions. Why do we have to compare ourselves with white women? And what are the, when you talked about the chemical haircut product, is that not part of what we're doing to ourselves to try to superficially look good and killing ourselves at the same time?
When it comes to the hair products and some of these products, I'm so glad that, people are really asking the questions now, and what does this mean? And making some movement from that standpoint. When it comes to chemicals, I feel like that's the only place where there's been movement. when it comes to a cancer diagnosis. And yeah, it sucks because you see the lawyer commercials all day, every day. But I'm glad that a light is being shined on this, because all of these things, they're almost always pushed in our community. So now it's time to take a deep dive and look at it. And let's be very clear. I'm always very open and honest. I'm a victim too. I have been getting relaxers my whole freaking life. Have I increased my risk? Absolutely. I have
Yeah.
time in my hair right now. And so we really need to be self-reflective and think of the things that we're doing to ourselves. And I'm glad that more physicians, specifically Black physicians, are also talking about this also. When it comes to comparison, it really sucks. We've been getting compared since the beginning of time, but it really, we need to compare, because once you compare, you shine a light, and then you can start making some changes. And as people who, helped build this country, we should enjoy this country and not be the ones that are negatively impacted by everything. And studies have shown, as I mentioned before, I'm a huge supporter of, I love health disparities and looking at it, because we need to fix it.
Yeah.
And studies have shown that from screening all the way to survivorship, Black women are negatively impacted, whether it's going to a freestanding radiology center that's probably not even certified, to not getting the treatments and the care and attention we
Wow.
need after we've made it through a cancer diagnosis. And so we need to shine the light. We need to continue to talk about it. I'm going to continue to talk about it until everybody's sick of me.
Good. Gore. We're going to go to break, and we'll come right back right here with.
Thank you for your question, Gideon. I appreciate it.
Mm-hmm. Yeah, we've gone to break.
Hey, this is Mr. Bird, aka the Frugal Credit Financial Educator, Certified Credit Counselor, Consumer Advocate, and you are listening to On Point with Juandolyn Stokes on News and Talk 1380 WAOK, the voice of the community.
The new WAOK listener line number is 404-726-1380. That's 404-726-1380. Call in now with your questions or comments on News and Talk 1380 WAOK. Someone struggled and fought for your right to vote. Use it. News and Talk 1380 WAOK reminds you the deadline to register to vote in the November 5th election is October 7th. Your vote counts. From WAOK Atlanta, WVEE HD3, the voice of the community. WAOK. We're always live and free on the Odyssey app. Breaking news, sports, weather, coming from the WAOK News Center.
NBC News Radio. I'm Chris Coraggio. Search and recovery efforts in North Carolina are in their 6th day following Hurricane Helene. Buncombe County Manager Avriel Pinder updated the death toll in her region.
Our confirmed loss of life this morning remains at 57 people.
Overall, more than 160 people have died across the Southeast region.
Well, you're still with us. We are on
an aerial tour of the damage in western North Carolina today. More than 345,000 North Carolinians are still without power. The Biden administration is supporting U.S. dock workers on day 2 of a major union strike. The strike by the International Longshoremen's Association entered its 2nd day today and is blocking everything from food to vehicle shipments and ports from Maine to Texas. Analysts estimate that the strike could cost the U.S. economy roughly $5 billion a day. The union represents about 45,000 U.S. dock workers who went on strike just after midnight early Tuesday after contract negotiations collapsed. The vice presidential debate between Ohio Senator J.D. Vance and Minnesota Governor Tim Walz candidates a chance to display their policy differences. The topics discussed included abortion, the economy, inflation, Middle Eastern conflicts, and more. They squared off at the CBS event Tuesday night.
The things that she's recommending to us that we need to do, even when it comes to breast cancer, making sure diet, exercise, eating clean.
Your family history.
Know your family history. Oh my God.
Please.
Oh my God. Genetics. Wow. Genetics are very powerful, right, doctor?
Very, very.
Oh
very.
my God. I mean, some things we just are diagnosed with, we couldn't avoid it because it's in our genetics.
Mm-hmm.
Is there a way to avoid any of that?
No, you can't really change your family history. And it's important to know because even if you get genetic testing and it's negative, right, your family history still impacts your risk. And so it's something that we need to know. If mom got diagnosed with breast cancer at 40, we should start screening you at 30. And so that 35 age I talked about earlier, that goes out the window. Same with colon cancer. Say mom was diagnosed or dad was diagnosed with colon cancer at 50. You have to start getting your colonoscopies at 40, even though they've decreased the screening age from 50 to 45 to start. And so knowing your family history is extremely important because it also helps us guide your care. It helps us figure out maybe we need to do imaging more frequently for you. And to be sensitive to this, there are some people who truly don't know their family history. For example, some people are in the foster system, some people were adopted. And if that's the case for you and you truly don't know, we always recommend genetic testing for those patients because it gives us somewhere to start. And so ask those questions.
That genetic testing, is that kind of like a simple testing, blood work, or?
It can be either or blood work, or they'll take a spit sample or swab the inside of your mouth to get the sample. And then it goes in the tube, gets mailed off to the lab. And within usually 2 to 3 weeks, you get your report back.
We're talking about, knowing your family history, genetic testing. We're talking about breast cancer awareness with Dr. Ryland Gore. Dr. V is on the line. Dr. V, go right ahead.
Good afternoon, Dr. Stokes and Dr. Gore. How are you both?
Good. How are you?
Good. I hope that you allow me to get a political point in here too for a capture for Dr. Stokes. But I want to share some information with you. Number one is that I'm a patient of malignant carcinoma of the right renal. And for legal term, that means that cancer of the right kidney. So I wanted to share with you and your listening audience that there's a doctor here at the Morehouse School of Medicine by the name of Hagar Nicole Green that has invented or found a cure for cancer with nanoparticles. So for those who don't know about her, look up Dr. Nicole Green. She came out of Alabama A&M State University, and she has found a cure for cancer. So if you want to support her, look her up and support her foundation so that, can get away from the big business or the pharmaceutical business of curing cancer or just treating the symptoms of cancer in opposed to getting rid of the cancer. So I wanted to share the information with your listening audience, Dr. Stokes and Dr. Gore. And you may have heard of her. Have you heard of her before, Dr. Gore?
I have.
Okay. Very sharp lady. And not only is she very sharp, but she's very good at what she does. And she is collecting and raising money now for, to increase her foundation.
Thank you. Yeah, thank you for because that's a resource, and certainly it's all about researching and things of that nature. So thank you so very much, and certainly our audience can look her up. Appreciate you, Dr. V. Stay healthy, stay connected, stay on point. Dr. Gore, what are some things that you would like to see change, or legislation changed, or happen in the breast cancer world that would really help a lot of patients?
So much has already happened and that I think are good things, especially, for example, it's old now, but the Women's Health Care Act, for example, of 92, where you can get reconstruction, you can get insurance pays for it, things that help women still feel like themselves, even in the midst of a devastating diagnosis. And men, let's be very clear, let's include them too. I think moving forward, precision medicine and using a patient's own genetic information to have very targeted treatments. I would like to see where that ends up. I think that's going to be a very special change in medicine. I know the research is going on now, but it'll be very interesting to see. We have everybody's getting genetic testing. So what if we can use your own genes and your own self to heal you also?
Wow. Oh,
so I think it'll be interesting to see.
Yeah.
I think for all cancers, not just breast, we have a long way to go. But there's forward movement every single day, and that's where the hope lies, right?
Yes, yes, we certainly do. Any closing thoughts before you leave? And certainly, I appreciate your time with sharing with our audience. Every time we ask you, you're right here, and we thank you.
As always, I want to say thank you to you and your team, your producers. You guys are always so welcoming, and every year, every other year, I'm back here with you, and I appreciate your support. I want to tell the patients, if you feel something, say something. Don't wait, and don't second guess yourself. Trust yourself, trust your gut, and it doesn't have to be me, but whoever your team is, curate a team that you feel very comfortable with, so that you do feel comfortable with sharing. And God forbid you need treatment for something, you feel you can communicate with them.
Yeah, yeah. And Dream Breast Care Center, where's it located, and what's the phone number and website?
Yes, www.dreambreastcare.com. We are at 371 East Paces Ferry Road, Suite 600, Atlanta 30305. We're the medical building right by the Thompson Hotel. And our number is 470-634-6849.
Awesome. Well, thank you so much, Dr. Gore. I appreciate you. Listen, he's an awesome breast surgeon, an awesome person. Thank you for caring. Thank you for caring about all of us. We'll be in touch. Thank you. Have a great one.
You too.
Yeah. That's Dr. Ryland Gore right here on Point with Juandolyn Stokes. We'll go to break, and we'll be back with more.
Greetings, this is two-time Grammy Award-winning artist Mosho Ishii, and you are listening to On Point with Juandolyn Stokes.
Thank you for listening and watching. All month long, we'll be doing breast cancer awareness here on Point with Juandolyn Stokes. Weekdays, 10 a.m. until 1 p.m. Make sure you lock it in. And also with this video, like it and share it. Share it with your audience. There's so many people
WAOK.
Word about breast
Eric Bozeman gives it to you straight. You shouldn't sit in jail for no 4 or 5 months because you couldn't pay $100.
We'll go back live on the air. I'm going to sign off here.
No ice. Because a cash bond is required. Where is a homeless man going to get $100?
No water.
Where I'm going to get $100 from on a night like tonight?
You won't hear him apologize for loving black people.